Hey there, welcome back to How to Medicate, and as you might have guessed from the title and the thumbnail, this video will be on alcoholism. We will cover all the ins and outs, what is alcoholism exactly, some tips and tricks for dealing with alcoholism, and lastly I will discuss a treatment plan which you can discuss with your own doctor if necessary. So watch the whole video so you don't miss any important information. For those of you that know the channel, I put a playlist in the description on mental health problems, so there's more good information there. Check it out after watching this video. And now let me quickly introduce myself. My name is Raoul, I'm a medical doctor from the Netherlands, and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that educated people make healthier decisions, which is the whole point of this video and this entire channel. And of course this video comes with a quick disclaimer. It's meant purely informative, this is not medical advice, and when looking for medical advice, you know it, contact your own doctor. Now let's get learning. So as promised, we will start by explaining exactly what alcoholism is. And as always I always start with Google. And when Googling alcoholism, you find the following definition. Alcoholism is a chronic, progressive, potentially fatal disorder marked by excessive and usually compulsive drinking of alcohol, leading to psychological and physical dependence or addiction. Now in the DSM-5, which is the most used diagnostic manual for mental health disorders, something most doctors use worldwide, alcoholism is called an alcohol use disorder. And it's defined as following: a maladaptive pattern of alcohol use leading to significant impairment and/or distress. And in addition, in order to be diagnosed with alcoholism or an alcohol use disorder, at least two of the following symptoms need to be present in the last 12-month period. The alcohol consumption is often larger than intended. Previous efforts to cut down alcohol use were unsuccessful. A huge part of the day is devoted on obtaining alcohol, using it, or recovering from it. There is a strong desire to use alcohol. The alcohol usage results in failure to fulfill obligations at work, school, or at home. Important social, occupational, or recreational activities are missed because of the usage of alcohol. And lastly, alcohol is even used in situations where it can be physically dangerous, like drinking and driving. Which brings us to the symptoms and the risks of the usage of alcohol. And here it is important to note that both are directly correlated with the volume of alcohol which is consumed and the frequency someone binge drinks, which is consuming a large amount of alcohol at a single occasion. So let's start with some short-term side effects. So as you probably all know, drinking a little amount of alcohol, so a blood alcohol concentration of 0.03 to 0.12%, may improve your mood, it may increase self-confidence, may decrease anxiety, and it may possibly lead to euphoria. However, when someone keeps on drinking and the blood alcohol level increases to about 0.09 to 0.25%, this can cause fatigue, sedation, a blurred vision, and balance problems. And when the blood alcohol further rises to about 0.18 to 0.30%, it can further cause confusion, unimpaired speech, dizziness, and vomiting. And if a person even continues from these levels, it may lead to unconsciousness, amnesia, respiratory depression, and ultimately a fatal alcohol poisoning. And for those of you wondering, what is excessive drinking? For women, it's drinking 4 or more consumptions of alcohol at a single occasion, and for a man, it's 5 or more. Or for women, it's drinking more than 8 consumptions of alcohol per week, and for a man, it's 15 or more per week. Which brings us to the long-term side effects of drinking too much alcohol. It may cause an increased tolerance to alcohol, an increased dependence. It may increase your risk for heart diseases like high blood pressure, heart rhythm problems, or even a stroke. It can lead to abdominal diseases like liver cirrhosis, inflammation of your pancreas, nutritional deficiencies, and/or peptic ulcers. It may cause neurological diseases like dementia, neuropathy, or epilepsy. It might contribute to mental health disorders like depression, anxiety, or psychosis, and it may increase your risk for multiple forms of cancer. Now you might wonder what causes alcoholism, as a huge part of the world regularly consumes alcohol, but not everybody develops it. Although the prevalence is huge, about 5.1% of the worldwide population over the age of 15 deals with alcoholism. which causes about 95,000 deaths each year in the United States alone, making it a major public health problem. And recent research learned us that the causes of alcoholism are quite complex. It's caused by multiple factors like your genetics, psychological factors, and the environment in which you grew up in. And it was found that experiencing severe childhood trauma is also associated with an increased risk of drug dependency like alcohol. Which brings us to the treatment of an alcohol use disorder. And here I want to mention that if you're worried that your alcohol consumption is too high, or if you have any of the previously mentioned symptoms, always discuss these with your personal doctor. He or she can help you to find if indeed your alcohol consumption is too high, and they can help you come up with a proper treatment plan if necessary. Your doctor might do this by asking about your medical history, your current alcohol usage, your current symptoms, the medication you're using, and afterwards your doctor might do a physical examination and do some blood tests. If necessary, your doctor could also refer you to a gastroenterologist or a mental health professional, depending on the underlying problems and causes. Personally, you could also try some of the following tips and tricks which might help you to control or decrease your alcohol usage. Take some time to reflect on your alcohol usage. Try to find out how much you're exactly drinking and why you're doing it. Secondly, you could try to talk about it. Let your friends and your family know you're trying to stop drinking. They might help and motivate you. Here it is also important you come up with a response you can offer to people when you turn down a drink, as people might ask why. Of course, you're not obligated to offer any details, but you could answer with, "I'm cutting back for my health." Next up, you could get rid of all the alcohol in your house and your environment, and you could change some typical routines. If you find yourself drinking a lot of alcohol with a certain person or when you're in a certain mood, change your routines. This may help a huge deal in improving your alcohol consumption. And lastly, take good care of yourself, as quitting alcohol can be challenging. Try to get at least 7 to 9 hours of sleep each night, maintain a structured sleeping and day schedule, eat enough vegetables and vitamins, drink about 2 liters of water each day, and exercise regularly. Now, if you tried all of these tips but they were insufficient, then your doctor might come up with a proper treatment plan. Usually, these treatment plans start with the discontinuing of alcohol, after which training and psychotherapy are used to prevent any relapse. As mentioned, alcoholism is caused by multiple factors. Therefore, they must all be addressed to successfully prevent a relapse. So the first step, as mentioned, is quitting alcohol. This can be done alone or it can be done in a detox clinic. During the detox, patients might also be prescribed benzodiazepines, which have a dazing effect, or they might be prescribed disulfiram. This drug blocks an enzyme that is involved in metabolizing alcohol, causing severe side effects like nausea and puking when someone combines it with alcohol. Both drugs are meant to prevent a relapse. Secondly, when you successfully manage to quit alcohol, psychotherapy or training is started. This is aimed at reducing your chances on relapse. This can also be followed individually or in a group setting. In psychotherapy, the underlying psychological problems which contribute to alcoholism are addressed, with the aim to overcome these. In addition, your therapist can provide you with some skills, tips and tricks to prevent a future relapse. Effective treatment forms are cognitive behavioral therapy, dialectic behavioral therapy, motivational interviewing, sometimes in combination with mindfulness. Lastly, I want to mention that quitting alcohol is not easy. It will cause side effects the first few weeks to months, a depressed mood, anxiety, tremors, and you will have to explain yourself against friends and family members who ask why you stopped drinking alcohol. Although, I hope this video made perfectly clear why you should stop, and I hope I gave you some tips and tricks and a treatment plan which you can discuss with your doctor, which might help you to quit yourself. You can do it, you can quit, and you do not have to do it alone. Please contact your doctor and ask him or her for help, and if you have the confidence, also discuss it with a loved one, a friend or a family member. This can help tremendously. Now, I hope this video was helpful. I hope you know now what alcoholism is, and I hope you have some useful tools to discuss with your doctor. If you have any questions, let me know in the comment section below. And for those of you that want to keep on learning, check out the playlist in the description for more medical information, because educated people make healthier decisions, which is the whole point of this channel. I also want to thank all of you for watching. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal. And in return, you will never miss such an awesome medical video ever again. Also, thanks to my Patreon supporters. Thank you, Sebastian, for this. I also want to give thanks to my Patreon supporters. Thank you, Sebastian, who's an investor tier supporter. Once again, thank all of you. And for those of you that can't get enough, check out my Instagram @howtomedicate, posting there a few times a week. Thank you all, and as always, I will see you next week with a new video. Bye bye.